everyone. Uh, I'm going live for a second time in a very long time, and so I do apologize for doubling down. And again, this is not something that I've done a lot recently. Um, but while I have the camera and the rig set up, I thought I would take a moment to talk about an incident that happened while I was working for a shelter in the Niagara region. I want to share the kind of quality of care that unhoused individuals can experience when they put their faith in service providers, more importantly, the region. So this goes back a few years, and to maintain the confidentiality and dignity of the unhoused individual, I will be referring to them generically, and I'll call this person Ruben for the purpose of this story. So one night I was working at a temporary winter shelter in the city of Niagara Falls. This is a shelter that was operating out of a church, and it was only during the winter season, the coldest point during the winter season. We would open at 6 p.m. every night, and typically between 5:30 to 7, you'd see the unhoused individuals kind of gather around this church and queue up to get a spot. Because this was during COVID, we only had a very limited number of spaces available for the unhoused. So when it was particularly cold in late November, December, January, February, there would be a rush to get the 28 spaces, 26 spaces that were available. And often we would operate over capacity because it's hard to turn someone away in the middle of winter when there's a friggin' blizzard outside. So we would operate over capacity. One night, it was either December or January, and Niagara Falls was getting hit with a particularly devastating blizzard, a multi-day blizzard, and it was nearing the end of my shift. It was around 11 o'clock, and I finished either 11 or 12 at night most nights because I was still in school, I was still studying. And Ruben, this unhoused individual, who didn't stay with us every night, he would only come to our shelter when it was particularly cold. Ruben didn't have a drug addiction, but there were some underlying mental health issues, and from what I've been told, though I never witnessed this, apparently he does drink, which I drink, so or at least I used to, so I'm not going to fault him or anyone for that. I never saw him intoxicated. Ruben was always nice to me and the other staff. He was a gentle giant. He was a very tall man. Anyway, it's nearing the end of my shift. I'm thinking about how am I going to go from this warm church to my warm house, my home. Driving from Niagara Falls to the city of St. Catharines in this blizzard. And again, just within an hour of me leaving, and as the other temporary winter shelter staff were coming in, Ruben knocked on the door. We had already kind of locked the door because we were at capacity. It was a blizzard outside. We were at capacity by like 7:30, or maybe even earlier than that. People wanted in, and people got in. Ruben, I don't know exactly where he resides, and we'll circle back to that in a moment, but I don't know exactly where he's from, but he got there late. I looked in Hyphus. Hyphus is an information management system that is used to track those that are receiving homelessness and housing services, plus some other services that the region provides. It's software that was created by the federal government and given freely to municipalities to kind of ease the burden of having to develop proprietary software. So I opened up HIFIS, I logged in, and through HIFIS I can find what other shelters he is eligible for and what other shelters have availability. And just like a hotel booking website, HIFIS will say shelter A is at 89% capacity. Shelter B is at 100% capacity. Well, on this particular day, it wasn't a blizzard that was just impacting Niagara Falls. The blizzard was happening across the region. So every shelter that Ruben was eligible for was full. Everything was tracking at 100%. Now, as I mentioned in a previous video, HIFIS doesn't always record accurate numbers for bed availability at all the shelters, all the service providers. So I pick up the phone and I start calling shelter to shelter to shelter, where where Ruben is able to say. By the way, Dave is not his actual name. So I start calling all of these shelters, and everyone was telling me what HIFIS said. Sorry, we're full. Sorry, we're full. We're actually too full. And there were some shelters that had availability. However, unfortunately, they were shelters that couldn't accommodate Ruben because of his gender and his age. Some shelters will only serve males. Some will only serve females. Some will only serve families with young children. And Ruben, again, his name's not Dave or Ruben. Ruben didn't qualify for any of these shelters. So I called Nassau. I called 211 and asked for Nassau, which put me into contact with what we call the overflow shelter. This is a shelter that provides kind of beds of last measure. It's the place that you're supposed to go to last. And during COVID, anyone that had suspected cases of COVID would go to this overflow shelter because we want to isolate them from the other unhoused individuals, because if an unhoused individual gets sick with COVID because of other comorbidities, they're particularly vulnerable. And because they don't necessarily have someone looking out for them, if they get sick, it could their health could decline very quickly and go unnoticed. So we would isolate people with suspected cases of COVID or that had risk factors that could make catching COVID dangerous. So I called the overflow shelter, which is a hotel that the region of Niagara paid for and maintained in the city of Welland. I'm not supposed to be telling you this, by the way. I'm not supposed to know that this hotel is in Welland. I'm not supposed to know that it's a hotel, where it's located, but I do because of the work I did, because of the contacts that I have. And I mean, ultimately, if you wanted to file a FIPA request for this information, it is freely available. Anyway, I call the overflow shelter in Welland, and I ask them, do you have any beds available for Ruben? The first person I speak to basically says no. Now, I happen to know a staff member that was working that day in the overflow shelter. So I back channel communications to them. I go, look, we have a participant. That's what we call people that use our services. We have a participant that came in late, and unfortunately, we're over capacity, and all the shelters are filled up. I'm being told there are no spaces in our overflow hotel or overflow shelter. Do you have space available? And this employee that I know they said, yeah, like our place is basically at 10% occupancy, meaning 90% of the available rooms are not being used. So I found it alarming that the first person I spoke to, the first point of contact, said no, there were no beds available. So I called back, and this is all at like, now we're approaching midnight. It's midnight. I call back to 211, and I asked to speak to a supervisor at the overflow shelter, or at least a supervisor that oversees and is on call for this overflow shelter. I tell them that I'm aware that they do have beds. So they put me on hold for a very long time, like 15 or 20 minutes. I don't know who they're calling. I'm presuming a senior bureaucrat at the Niagara Region at midnight on like a Friday. So they put me on hold for 15, 20 minutes. They come back and they said, look, we need to speak to Ruben directly to see if he qualifies for our overflow program. So I pass my cell phone to Ruben, and Ruben gets on the phone and he's talking to them for about 5 or 10 minutes. I only hear the one side of the conversation, but I already know the questions they're asking him. They're asking, does he have a place to go to? Are there any friends or family that can take him? Why did he come so late? Has he been using today? Meaning drugs or alcohol or whatever. And he's answering the questions all correctly, and I directed him to answer them honestly. He had no friends or family to rely on. He doesn't have a big circle of friends or family, unfortunately. He had not been using. And Ruben passes the phone back to me. I speak to this supervisor, and the supervisor says, look, based on our records in Hyphus, Ruben has a home that he can go to. So I put them on hold, and I asked Ruben, is it true that you have a home that you can go to? They're telling me that you have a house. Why are you here? Ruben then explains to me that at some point in his past, I don't know if it was recent past, but at some point in his past, he had either been given or purchased, I don't know, a trailer, like a mobile home, like a very, very small mobile home. One of the ones that you can pull with like a truck. So I'm thinking, well, this is a solution perhaps. So I ask Ruben for more details. Ruben, at that point, at the front foyer of this church, breaks down. And he is, again, a large, quiet man, but he breaks down and he tells me in this moment of weakness that his trailer that he was residing in and that he tries to reside in, and when he's not on our shelter he is at, this trailer, this home that the region is sending him back to, is actually has no ceiling, no roof. There's a giant hole. Rust has eaten it through. He's got no roof. Snow and melted snow, water, and all that is coming through the roof. And because of the state of his house, his utilities have been cut off because the region of Niagara deemed his trailer was uninhabitable. It was condemned. And because of that, because of the state of his trailer, the utilities were cut off because it was a danger. It was a fire hazard to him, any occupants inside, and neighbors. I don't even think he had neighbors, but potential, theoretical neighbors. So they cut off his power, his water. He had no heat. There's a hole in the roof. And the region is saying, we're not going to let you in this empty hotel that we've already paid for, mind you. We've rented for the entirety of the winter. We're not going to let you into this space because you have a giant rotted out trailer with no heat, water, or electricity. This is the kind of care that the unhoused individuals in this region, whether they're permanently unhoused, chronically unhoused, or whether they're intermittently unhoused or have insecure housing. This is the kind of care that they can expect from the region and from the city of St. Catharines. So when disingenuous people like Matt Sisko and David Oakes say that we're not going to target these people until we find out that there are no spaces. If there are spaces to go to and they don't, then we'll put a tax on them. We'll levy these unhoused individuals who are subsistently living off of OW and ODSP. We're going to tax them if they have a place to go to and they're choosing not to go to. So don't buy into the propaganda and the slick marketing that sick autocrats like Matt Sisko are trying to dump down your throats and into your ears. They are going after the unhoused, and I can assure you that there is a large population of unhoused individuals that cannot or will not go to a shelter because of traumatic experiences of rape, of theft, of abuse from police or shelter staff in rare circumstances. They can't or won't go back, or because they've created a dry shelter and these people are they're self-medicating and can't get into these shelters. But privileged people like David Oakes and Matt Sisko, who don't understand the barriers to shelters, will tell you that, oh, well, they have a place to go to. They're just opting because it's a personal decision. It's an easy personal decision for these individuals. It is not. And I went on a little bit of a rant there, but this is just one of literally dozens of stories I have from unhoused individuals who were denied access to shelter when spaces were available. The region said no because someone had somewhere to go. When really, did they? Ruben was expected to go sit on a rotted out couch that is all moldy, with no hole, with no ceiling, with snow drifting in, no heat or water, and in minus 10, minus 15 degree weather. They're saying he's got a place to go to, so we're not going to let him into a place that has a heat, a bed, and running water. So the system isn't perfect. Matt thinks it is. Matt wants you to believe the system is perfect and will find a home for everybody that wants one, discounting the people that can't or won't be housed. So again, I apologize for this very long rant, but I wanted to give you an idea of what working as a shelter worker is like. And one of the reasons why there is such high turnover for shelter workers is because I had to turn people like Ruben away. So after an hour on the phone with 2-on-1 with NASO, with every resource I could dig up, I had to tell Ruben to go outside and sleep on the bench out in front of the church. I drove home. That night in my warm car, and I went home where I could sleep warm. Well, Ruben was covered in snow out in front of the church. We couldn't let him in because if the region showed up and found that we were over capacity, it would shut down the shelter and everyone would be out. Ruben wanted to go somewhere warm, but there was nowhere to go. Now the mayor of the city of St. Catharines wants to target him and wants to take what little he has and throw it in the garbage and then make him pay to clean it up and make him pay a fine that you cannot get judicially reviewed. So let's not pretend that our unhoused people have a choice of where to go. They're not living rough on the edges of our city limits because there's a choice. These people have never had a choice. And even when they do want to seek somewhere warm to go, somewhere safe, we don't make that available. Thank you.